Hey guys, welcome back to my YouTube video channel again. I'm going to show you a couple things about this presentation. The first one, the topic today is brace or cosmetic veneer. Do you want to do braces or you want to just put cosmetic veneer and get your smile back on track? Or basically the idea is that I want to elaborate more about the different what we call a minimum invasive dentistry versus cosmetic dentistry, and so on and so forth. So let me go ahead and start with the quick things. So basically the minimum invasive dentistry is basically some of the key thing is it have no surgery. You don't do any surgery, okay? Or you have cutting, you don't cut anything. You don't cut any teeth. I want to go back. So no prep veneer and things like that, or it's minimum invasive dentistry, for example, it's not irreversible. It means that if you do something, you probably can reverse the case. You don't use any scalpel or blade to cut the gum or anything like that. And you don't typically need sometimes you don't need use needle. That's also called minimum invasive dentistry. Or you tend to the procedure, then you tend to have no bleeding, or you don't have any jaw bone removed, and no pain, no sensitivity. So those are called minimum invasive dentistry. Now, non-invasive dentistry involve like we're doing a crown, root canal, jaw surgery, gum surgery, veneer, prepping the veneer. Some veneer is called minimally. If you don't prep the teeth, that's called minimum as well. Or when you do a bridge, an implant, tooth extraction, all of those are considered, invasive procedure. So crown lengthening, gingivectomy, or pulpectomy. I mean, those are considered invasive procedure. So the reason I want to do that is because I want to show you a case. And what do you think about what we're going to do in this case? So if you are a patient, you look at your smile, this is how you look like. And you say, I don't see anything wrong with it. Let's zoom in a little bit deeper. On the sideways, you look pretty nice profile. Because the case haven't started completely, I want to have you, I have some discussion about with this guy. So look at this one. Patient smile, when she put her lower jaw forward, you can see there's a tendency of the grinding happening right here, the wear and tear of the enamel right here. And so there is a minor crowding on top, minor crowding on the bottom. But the problem is her teeth on the upper and lower anterior is really getting shorter. She's about 30 something years old. So I wish she had done braces years ago, then she ended up having no problem with this type of problem. But now you look at this one, you say, yeah, well, put some veneer and get this beautiful smile, custom gum. Yeah, that's one way to do, right? There's nothing really considered a right and wrong answer for dentistry, as long as you know what you're doing. But look at this gum right here. Look careful of her smile. She have a gummy smile. She have, when she put her teeth together with the tongue put together, right there, that is where the teeth is really worn out. What do we do? So general dentist, you love to cut the teeth, get the crown lengthening, put some veneer, you got a patient smile. That seems to be good, but you don't solve the problem because you still have crowding bottom teeth here, crowded on the upper, and then eventually those cosmetic procedure will eventually wear and tear and will break down again. So there is a muscular involved. There is the habitual problem here that we have to figure out. So I zoom in again and show this case. Now look carefully, you can see that minor case, but there is heavy muscle involved and grinding on the front teeth here habitually, and that is a problem. If you just thinking about veneer or crown and stuff like that, and that is something that I see a lot done. I say I'm not against what you guys doing. I'm just trying to give you another option to do is, why not braces, okay? Like this. Correct braces would straight the patient teeth out top and bottom, treat the gum, some bleeding gum, because a crowded teeth like this, the gum is not healthy, as you can see when I zoom in. Occlusal, as you can see, that minor crowding, little rotation of 8 and 9 and 10, and minor rotation of 12 and 13, very minor. And same thing on the bottom here, minor rotation of lower incisor, a little bit of inward rotation of the premolar. But just those, simply like that, can cause a major problem for the patient, guys. Look carefully. I want to zoom in, see enamel wearing. And as you can see, there's some restoration of back. That means the patient had done a lot of damage herself with habitual grinding and rotation of the teeth that you can see right there, number 4, rotation, and anterior rotation, minor. But if you fix those minor, give the patient the appliance to wear, she will have a long-term result, better result. So I want to talk about veneers for those patients that watching this one and say, so what the advantage of veneer? Well, the advantage of veneer is really looking really nice, beautiful work. You know, you get the lab done, the dentist do some prepping, it's going to turn out beautifully. It's also, you know, if you are like a wine drinker and, you know, you eat some colorful food, it doesn't stand, you can remove that. So durability, you know, porcelain veneer look relatively longer than the composite veneer, or, you know, people can claim from like 5, 6, 5, 7 year to 15 year. So depend on the dentist, okay? You have to talk to the dentist who have experience on that. Color, versatility, you know, with the porcelain, you can increase or decrease your color of your teeth, your shade. You want to look wonderful, wider, easier shaping, you know, with the veneer, you can change the shape of your tooth. You can make it look longer, bigger. The lab can coordinate with a doctor and do that. And you can improve your appearance and restore more confidence. I agree with that. All of these are advantages of the veneer. The disadvantage of veneer is, you know, it again, it's artificially, it can look, it look realistic for most case if you get a good lab done. Some lab can give you really unnatural looking. So it pays on what you pay, what you get. And so you talk to your doctor. The cost can be expensive, you guys. And it can be fragile, or it can, and if it break, you know, when you grind your teeth, you see when you grind, you eat heavy food, it can be a problem. So you have to worry about that. Permanently, well, it permanently done. When you do this procedure, it's not gonna go. You can't go back if you do the procedure that require the prepping. I remember I talked about minimum invasive, and if you prep the teeth, there's no turning back. You prep the teeth, your smile gonna be like that. If you have to continue with the dental restoration, like a veneer or crown, things like that, in order for you to keep up with your smile. So there's a cost involved. Sensitivity, yes, teeth can be sensitive after prepping the teeth. And so, you know, depending on how much tooth structure we reduce, it can be very sensitive. And you may not be a candidate if you have an unhealthy gum, like bad teeth, bad gum, decay, a lot of decay. You might have to get like crown instead of a veneer. So those are just some disadvantages. I just want to have some idea, give the patient a chance to have them checking out this video. And so again, what is the advantage of braces? Well, advantage of braces is you, if you don't, if your teeth look fine, when we straighten it up, you don't need to have anything no to cut in teeth, nothing cutting, okay? No, nothing damaging your teeth besides straight your teeth. Sensitivity, very little, minimum or nothing. Cost probably less than veneer, because if you want to invest the nice smile or using the veneer, you have to pay a lot of money for your 20, 30 teeth that you want to do with whiter or complete mouth whitening with veneer. But you have orthodontists, the cost probably range from 5,000 to 10,000 maximum. And it can depend on the doctor that do the work, tend to be a lot lesser than veneer. Veneer, some doctor in high city, high-end city can charge up to like 2,000-3,000 just one veneer. So it can be expensive. The TMJ, you guys, when you do braces, you actually improve your joint, your TMJ joint right here. It helps you a lot. Grinding, you reduce the grinding problem because your teeth is straight. Now you have some guidance, especially when you were young. So if you were younger, you should consider braces. Don't do veneer when you are young. Just try to save your teeth as much as you can, as long as you can, with balancing your bite, balancing your muscle. Cost less in long term than crown. Okay, disadvantage braces, it could take a little longer because if you're an adult, sometimes you get married, sometimes you get a big occasion, you want to get beautiful smile, then you might have to jump into the cosmetics procedure like veneer, instant veneer, crown, like that. One day dentistry. Braces take longer, but the result gonna be more long-term result. It take you might have to wear retainer, and so also you can't really change the shape of the teeth a lot because you're not really putting any veneer on unless you choose to do that. Sometimes it can be inconvenient for those due to time. So those are some disadvantages of braces, but overall the key different thing is braces long-term result, most stable. Veneer can be an issue with the replacement and repairing. But overall, there is, again, I'm a dentist, I've been doing 20 years. I know that there is no right and wrong answer, depend on what you want to do for your teeth and you expect your expectation and your long-term expectation and your long-term financially able to support what you want to do. Again, thank you for watching and check out this channel. If you like what I say, please subscribe to my channel and make some comment below. I'm more than happy to answer your question. Thanks again. Have a great day. Bye-bye. Follow me to see this case. I want to show you the day before we start and after. Okay. Thank you, guys.